Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more important topic under rheumatology. So let's see the case. Okay. A middle-aged woman presents with pain, swelling, early morning stiffness of joints of the hands lasting more than 1 hour. So pause the video. What comes in your mind? TDs of this case. Yeah. The diagnosis is rheumatoid arthritis. So let's dig into rheumatoid arthritis topic. Rheumatoid arthritis is a chronic systemic autoimmune inflammatory disorder primarily affecting synovial joints, resulting in symmetrical, erosive polyarthritis and progressive joint restriction. So let's make it simple. There will be inflammatory condition which leads to synovial joint destruction will be seen in the symmetrical way. Where synovial joints will be there? Yeah, the large joints like knee and all, which leads to erosion of it and progressive destruction will be seen. That's it. Then coming to pathogenesis, autoimmune activation with loss of immune tolerance, formation of autoantibodies such as rheumatoid factors and anticyclic citrulinated peptide. I just read the full name. You can remember anti-CCP. That's enough for the exam. Then chronic synovial inflammation leads to pannus formation. It is nothing but erosion of the synovial joint, cartilages and all. Then cartilage destruction will be seen. Bony erosions will be seen. So I hope that was clear. Just remember your knee joint. Yeah, I know I am very bad at diagram. So just remember this is your knee joint. Typical example will be your knee joint for rheumatoid arthritis. First, it will be a destruction of the surrounding cartilages. Then there will be destruction in the joint space, which leads to there will be reduction of space, which leads to coming closure of the bony part, and there will be rubbing of both surfaces. So this is the actual layman pathophysiology. You can remember these 5 points. Okay, you have to write these 5 points when they ask rheumatoid arthritis pathophysiology. Then coming to risk factor, female gender, genetic predisposition, you need to remember HLA-DR4, smoking, hormonal factors. Clinical features, we have articular because it is related, most commonly manifestations will be related to articular. There may be some extra articular because it is immune system related. So there will be extra articular manifestation. So let's see what are the articular and extra articular features. Symmetrical involvement, it is given in the definition itself. It will be symmetrical. Small joints like hands and feet. Early morning stiffness lasting more than 1 hour. Swelling, pain and warm joint. Deformities such as ulnar deviation, swan neck deformity. Swan neck deformity is nothing but just take your finger and bend it like this. You can bend it like this. So it resembles like swan. I am very bad at diagram. Still adjust. Okay. This is swan. It even has legs and wings too. Yeah. Just this looks like swan, right? Yeah. That's what swan neck deformity means. Then bottom ear deformity. No need to remember detail. This one neck deformity, it is one of the 3 marker important 3 marker in orthopedics. You can just go and brush up your ortho department things. Then extra articular features, rheumatoid nodules, interstitial lung disease. This interstitial lung guy stays in every single disease in rheumatology. You don't know anything extra articular, just bluff it off. Don't take my name if there are exceptions. Okay. Then pleural effusions, vasculitis, anemia, ocular involvement, including scleritis. Then coming to investigation, there is some inflammation which leads to increase in ESR and CRP. Rheumatoid factor positivity will be seen because it is specific to rheumatoid arthritis. Then anti-CCP antibody of highly specific. This is the one investigation of choice. We are going to see if a rheumatoid arthritis patient comes to OPD. Then in X-ray, we are going to see joint space, as I said, narrowing and erosion of the bones will be seen. In ultrasound or MRI, we may see early sinusitis. No one do actually in the practical. If a patient comes and if you say some 10,000 investigation in the first visit only, the patient will run off. So don't do those blunders. Then management, we are going to do it with disease activity assessment. Disease activity assessment, which is done under disease activity, should be regularly assessed using CDAI. What it stands for, Clinical Disease Activity Index. No need to dig into this topic. It's an entrance question for theory, nothing to write more. It includes just for the curiosity, I just added 4 to 5 points about this topic. No, if you want, you can skip this topic. CDAI includes tender joint count, swollen joint count, patient global assessment, physical global assessment, And what is the importance of the CDAI is it helps in treatment escalation and monitoring responses. Then coming to management. So actual management starts here. If you want, you can skip that part. This is modifying therapy. So methotrexate is the first line of treatment for this. If someone asks when someone has rheumatoid arthritis, first thing you need to remember is methotrexate. Okay, methotrexate. Then other drugs like sulfasalazine, leflunomide, hydroxychloroquine. Then coming to other like biological therapy, we can give TNF alpha inhibitors. If you want, you can go and watch pharmacology videos wherever it is available. Other biologic agents for refractory diseases. Refractory means you are giving methotrexate and the patient is not responding. It is called as refractory diseases. Then coming to symptomatic treatment, if there is a pain, you have to give one pain relieving drug. So obviously we will give basic drug, that is NSAIDs, short-term corticosteroids for disease flares. Then coming to complications, there will be reduced space which leads to destruction of the joint. So joint destruction will be seen and deformities will be seen. Then increased cardiovascular morbidity, infections due to immunosuppressive therapy. Because of fever management drugs, the patient is getting another disease. So whenever you are giving some drugs, you need to be careful about the complications and side effects of it. Then coming to examples, this is important. You need to remember at the end while going to exam. Early morning stiffness will be seen, lasting more than 1 hour is the characteristic feature which we saw in the case. Then anti-CCP is highly specific. Then methotrexate is the drug of choice. CDI, just I added, if you are adding the point, then you need to remember this CDI is present. Then, okay, let's read the line of quick recap. Rheumatoid arthritis, yes, repeat before me, okay? Or even after me, okay? Rheumatoid arthritis is a chronic autoimmune disease causing symmetric polyarthritis. Regular assessment using CDI and early initiation of DMARDs are key to preventing joint damage. So let's quickly recap. Case, no need to discuss because you know joint stiffness will be there. So it's a chronic symptomatic autoimmune inflammatory disorder affecting synovial joints, symmetrical, erosive polyarthritis and progressive joint destruction. You need to write your definition because if you write your definition properly, your case will be properly solved. Just think you're writing your headings properly, how to like take an example of anatomy. If you're writing the headings properly, then you will come to know what to write under the topic. So don't forget to write definition whenever it is possible in the medicine. You'll be impressing the examiner easily. Then pathogenesis, autoimmune activation will be seen, which leads to loss of immune tolerance, which leads to formation of autoantibodies. Then leading to chronic synovial inflammation, pannus formation will be seen, cartilage destruction and bone erosions will be seen. Yeah. I said just because your knee joint, because it is a typical joint, you can just remember in rheumatoid arthritis, it will be most commonly, it will be involving small joints. Okay. Don't get confused. I forgot to just transfer the topic. Okay. Then coming to risk factor, female gender, genetic predisposition, HLA-DR4. You need to remember that. Smoking, hormonal factors. Then articular, extra-articular, just go into it. It takes long time. Then investigations, you're going to see ESR and CRP. Rheumatoid factor will be positive. You need to remember most important, anti-CCP, highly specific. Then in treatment, you're going to give methotrexate, very important drug. Even in pharmacology, that's a 5 marker. You can't skip the topic, right? Then biologic therapy will be given and symptomatic. If pain, you have to manage the pain treatment. Then complication, there will be joint destruction and deformity. The topic was beating around this word. Okay, so don't forget destruction and deformity. Increased cardiovascular mobility, infections will be seen due to immunosuppressive therapy. And there goes my examples. That's all for the video. I hope you people enjoyed the video. There is nothing to enjoy. I think you people understood the video. Subscribe for the more videos. Don't forget to subscribe. Thank you.